Good morning, students. Welcome to today's lecturer from Nehru College of Pharmacy. I am Dr. V. Sreedhar, professor in the Department of Pharmaceutics. In this session, we will discuss an important topic from Pharmaceutics 1, which is semi-solid dosage form. This topic is part of the first semester BPharm curriculum and the course code is C103T. This subtopic that we will begin with today is ointments, that is semi-solid dosage form, and during this lecture we will also understand the basics of semi-solid dosage form and thermal drug penetration. The teaching this topic will be using PowerPoint presentation and images for better understanding. So first, I have to know before starting the topic, let us understand the concept of course outcomes, which are commonly called COs. Course outcomes are clear statements that describe what a student should know or be able to do after completing a course. In simple words, course outcome answer the question. After completing this subject, what knowledge or skills should be student gain? For example, after completing pharmaceutics, one students should be able to understand the history of the pharmacy profession and understand the basics of different dosage forms and learn about the pharmaceutical incompatibilities and calculations and understand the professional handling of prescriptions and learn the preparation of various conventional dosage forms. These expected abilities of students are called course outcomes. Course outcomes are important because they guide students about what they will learn, and they also help teachers plan teaching methods and examinations effectively. To properly define course outcomes, we use an educational framework called Bloom's taxonomy. Bloom's taxonomy is a system used to classify different levels of learning, starting from simple thinking to more advanced thinking. In simple terms, it helps us understand how deeply a student understands a topic. Bloom taxonomy consists of 6 cognitive levels. The first level is remember, which student recall basic facts. The second level is understand, where student explain concepts in their own words. The third level is apply, where knowledge is used to solve problem. The fourth level is analyze, where information is broken into parts to understand relationship. The fifth level is evaluate, where students make judgment or assess information. The sixth and highest level is create, where students develop new ideas or design new systems. These levels help teachers design learning objectives and examination questions appropriately. To better understand root taxonomy, let us take a simple example related to semi-solid dosage form. At the remember level, students should be able to define semi-solid dosage form. At the understand level, students should be able to explain classifications and thermal penetration of drugs. At the apply level, students should be able to prepare ointments, creams or gels. At the analyze level, students should be able to compare different semi-solid formulation. At the evaluate level, students should be able to evaluate the quality of semi-solid preparations. Finally, at the create level, students should be able to design a new semi-solid formulations. Thus, Bloom's taxonomy helps in organizing learning from basic knowledge to advanced skills. Now, let us understand the connection between the course outcomes and Bloom's taxonomy. Course outcomes are usually written using action words from Bloom's taxonomy. Each course outcome is linked to a specific Bloom's level. For example, if the learning outcome says student will be able to prepare and evaluate pharmaceutical semi-solid dosage form, the word prepare corresponds to K3 level, which represents apply. The word evaluate corresponds to K5 level, which represents evaluate. So therefore, Bloom's taxonomy helps teachers write clear and measurable course outcome. In simple terms, course outcomes describe what students will be able to do after the course, while Bloom's taxonomy explain how deeply they understand the topic. Semi-solid dosage forms. Now let us move to Unit 5 of Pharmaceutics 1, which deals with the semi-solid dosage form. Semi-solid preparations are widely used in pharmacy for topical drug delivery, especially for skin diseases and local therapeutic action. These formulations are very common in medical practice and include products such as ointments, creams, gels, and pastes. In this unit, we will study the basic principles, preparation methods, and therapeutic applications of semi-solid dosage forms. Here you can see some examples of topical semi-solid preparations commonly available in the market. These include products such as ointments, creams, balms, and marketed gels. Many of these preparations are used for conditions such as skin infections, inflammation, dry skin, pain relief, minor wounds, and burns. For example, ointments like Aquaphor are used as skin protectants and moisturizers. Similarly, other topical preparations are used for anti-inflammatory or antimicrobial purposes. So these examples show how semi-solid dosage forms are widely used in clinical practice and daily healthcare. After completing this unit on semi-solid dosage forms, students should be able to understand several important concepts. First, student will learn what semi-solid dosage forms are and the different types, such as ointments, creams, gels, and paste. Second, they will understand how drugs penetrate through the skin and the factors affecting dermal drug absorption. Third, they will study the different types of bases and excipients used in semi-solid formulations and their pharmaceutical importance. Fourth, students will learn methods used for the preparation of semi-solid dosage forms such as the fusion method and trituration method. Finally, they will understand evaluation test and the therapeutic uses of semi-solid preparation. These objectives help guide students through the important learning outcomes of this unit. By the end of this lecture, you should be able to understand the several aspects of semi-solid dosage form. They include the definition of semi-solid dosage form, the classification of semi-solid dosage form. We will also learn about the dermal penetration of drugs and its mechanism, as well as its factors influencing dermal drug penetration. Let us begin with the definition of semi-solid dosage form. Semi-solid dosage form are pharmaceutical preparations that have a consistency between a solid and a liquid. These preparations are mainly intended for external application to the skin or mucous membranes. They are used either to produce a local effect, such as treating skin infections or inflammations, or in some cases to produce a systemic effect through transdermal drug delivery. Semi-solid dosage forms are designed for several purposes. First, they help protect the skin from external irritants and environmental factors. Second, they are used to deliver drugs locally or through the skin into the systemic circulation. Third, they may be provide emollient action and which softens and moisturizes the skin. They can also provide antiseptic, anti-inflammatory or medicated action depending on the active ingredients present in the formulation. Because of these advantages, semi-solid dosage forms are widely used in the dermatological therapy. Semi-solid dosage form can be classified in different ways. The first classification is based on their physical nature. The main types include ointments, creams, gels, and paste. Let us briefly discuss each type. First, ointments are greasy and sheer semi-solid preparations. They are mainly used for occlusive and protective action on the skin. Because of their greasy nature, ointment prevent moisture loss from the skin and help keep the skin hydrated. A common example is a sulfur ointment, which is used for certain skin conditions. So, next, are creams. Creams are emulsified semi-solid preparations, meaning they contain both oil and water phases. They are generally less greasy and more cosmetically acceptable compared to ointments. Creams are usually classified into two types. The first type is the oil in water cream, also called vanishing creams, where oil droplets are dispersed in water. The second type is water in oil creams, also known as cold creams, where water droplets are dispersed in oil. Another type of semi-solid preparation is gels. So gels are semi-solid system that containing gelling agent which form a three-dimensional network structure. They are usually transparent, non-greasy and easy to apply, which makes them very comfortable for patients. A common example is diclofenac gel, which is used to relieve pain and inflammation. Next are pastes. Pastes are semi-solid preparations that contain high percentage of finely dispersed solid particles, usually more than 25%. Because of this high solid content, pastes have a stiff consistency and provide protective action on the skin. An example is zinc oxide paste, which is often used as a protective skin preparations. Another type mentioned here, is also called as cataplasm. These are soft mild masses that are usually applied warm to the skin. However, poultices are rarely used in modern therapy as more advanced dosage forms are now available. Semi-solid dosage forms can be classified based on the therapeutic use. Depending on the drug present in the formulation, they can be used for different therapeutic purposes. For example, protective preparations are used to protect the skin from irritation or damage. A common example is zinc oxide ointment. Next are antiseptic preparations, which help kill or inhibit the growth of microorganisms. An example is powder iodine ointment, which is widely used for wound care. Another category is anti-inflammatory preparations which reduce inflammation and swelling. An example is hydrocortisone cream, commonly used in dermatological conditions. Semi-solid preparation can also be used as antifungal agents such as clotrimazole cream, which is used to treat fungal infections. Finally, some semi-solid preparations are used for transdermal drug delivery, where the drug is absorbed through the skin into systemic circulation. An example is nitroglycerin ointment, which is used in cardiovascular therapy. Another important classification of semi-solid dosage form, especially ointments, is based on the type of base used. The first type is homogeneous bases, also known as hydrocarbon bases. These bases are greasy and water insoluble and they provide an occlusive effect. An example is petroplatinum. The second type is absorption bases. These bases have the ability to absorb water, form water in oil emulsions. An example of an absorption base is lanolin. The third type is water removal bases. These are also known as oil in water emulsion bases and they are easily washable with water. An example is hydrophilic iodine. The fourth type is water soluble bases. These bases are completely water soluble and non-greasy and they are often prepared using polyethylene glycols commonly called PEG. Each type of base has different properties and influences the release and penetration of drug through the skin. Now let us discuss the mechanism of dermal penetration of drug. Dermal penetration refers to the process which a drug applied on the surface of the skin enters and diffuses through the different layers of the skin. After penetrating the skin layers, the drug may reach the dermis and sometimes even enter the systemic circulation. Depending on the drug and formulation, the effect may be local, such as treatment of skin infections or inflammation, or systemic, where the drug enters the bloodstreams and produces effect throughout the body. The skin acts as a selective barrier, meaning it allows some substances to pass through while preventing others. Among all the skin layers, the stratum corneum acts as the principal rate limiting barrier for drug penetration. So therefore, for successful topical drug delivery, the drug must overcome this barrier. To understand dermal penetration, it is important to know the structure of the skin. The skin consists of two major layers relevant to drug penetration, the epidermis and the dermis. The outermost part of the epidermis is called the stratum corneum, which is about 10 to 20 micrometers thick. This layer is composed of dead and catenized cells called that is corneocytes, which are embedded in a lipid matrix. Because of this structure, the stratum corneum acts as a main barrier for to drug penetration. Below the stratum corneum is the viable epidermis, which is contain living cells. This layer is metabolically active and offers much less resistance to drug diffusion compared to the stratum corneum. Below the epidermis lies the dermis, which is a highly vascularized layer. Once the drug reaches the dermis, it can be absorbed into the blood levels and making systemic absorption possible. The first step in dermal drug penetration is drug release from the dosage form. When a semi-solid preparation such as an ointment, cream or gel is applied on the skin, the drug must first be released from the formulation base. Only the free drug molecules released from the formulation are capable of penetrating the skin. The release of drug depends on several factors. These include the type of base used in the formulation, the solubility of the drug in the base, and the drug concentration present in the formulation. Therefore, proper formulation design is essential to ensure effective drug release. The second step in dermal penetration is partition of the drug into the stratum corneum. In this step, the drug moves from the formulation into the outermost layer of the skin. This process is governed by the partition coefficient, which is represented by the symbol K. The partition coefficient is defined as the ratio of drug concentration in the stratum corneum to the drug concentration in the formulation. If the value of K is high, the drug has a greater affinity for the skin, resulting in good penetration. However, the partition coefficient is very high, the drug may remain trapped in the stratum corneum and diffusion into the deep layers becomes poor. If the partition coefficient is very low, the drug tends to remain in the formulation and cannot easily enter the skin. So therefore, ideal drugs usually have moderate lipophilicity with a log P value between 1 and 3. The stratum corneum behaves like a lipophilic membrane, which means it favors unionized and lipophilic drugs. The third step is diffusion across the stratum corneum. Once the drugs enter the stratum corneum, it diffuses through the matrix by passive diffusion. The process follows fixed law of first diffusion. According to this law, the rate of drug penetration depends on several factors. That is, they represent the rate of drug penetration. D is the diffusion coefficient, which indicates how easily the drug molecules move through the membrane. K is the partition coefficient, which determines the distribution of drug between the formulation and the skin. And delta C is represent the concentration gradient, which drives the diffusion process. H represents the thickness of the stratum corneum. Since the stratum corneum provides the greatest resistance, this step is considered the rate limiting step in the dermal penetration. After crossing the stratum corneum, the drug enters the viable epidermis. In this step, the drug diffuses through the living epidermal cells. Compared to the stratum corneum, this layer offers lower, much lower resistance to drug diffusion because it has a more aqueous nature. However, The viable epidermis metabolically active and some drugs may undergo enzymatic metabolism in this layer before reaching the dermis. The final step in dermal penetration is diffusion through the dermis. The dermis contains blood capillaries and lymphatic vessels. Once the drug reaches this layer, it can be rapidly removed by systemic circulation. This removal helps maintain the concentration gradient, which further enhances the diffusion of the drug from the skin surfaces into deep layers. Therefore, dermis plays an important role in systemic absorption drugs applied on the skin. And thus dermal drug penetration occurs through a sequence of steps including drug release, partitioning to the stratum corneum and diffusion across the stratum corneum and passes through the viable epidermis and diffusion through the dermis. After understanding the mechanism of dermal penetration, let us now discuss the different routes through which drug penetrates the skin. Drugs applied on the skin can enter the body through three main pathways. These are intercellular route, transcellular route, and appendical route. Each pathway allows the drug to move through the skin in a different way depending on the physicochemical properties of the drug. The first and most important pathway is the intercellular route, which is considered the major pathway for dermal drug penetration. In this route, the drug diffuses through the lipid matrix present between the skin cells, which are called carnocytes. The stratum corneum can be imagined like a brick on mortar structure, where the carnocytes act as a bricks and the lipid matrix act the mortar. So the drug molecules move through the lipid layers between these cells. So because this pathway mainly involves lipids, it is preferred by lipophilic or fat soluble drugs. Due to the high lipid content of stratum corneum, the intracellular route becomes the most common route for the dermal absorption of the drugs. The second pathway is the transcellular route. In this route, the drug passes directly through the carnocytes, which are the cells of the stratum corneum. During this process, the drug must pass both lipid and aqueous regions repeatedly. This means the drug continuously moves between lipid layers and water containing cell components. Because of this repeated partitioning between lipids and aqueous phases, this pathway is considered more complex and less common than the intercellular route. This pathway generally favors hydrophilic drugs, which have higher solubility in aqueous environments. The third pathway is a appendical route, which is considered a major pathway for dermal drug penetration. In this route, the drug enters the skin through skin appendages such as hair follicles and sweat glands. Although this pathway contributes only a small portion of total drug absorption, it becomes important in certain situations. For example, it plays a role in the penetration of large molecule and ionic drugs, which cannot easily diffuse through the stratum corneum. It is also responsible for initial rapid absorption of some drugs because these appendages provide a direct pathway into deep layers of the skin. To summarize, the drugs can penetrate the skin through three main pathways. That is intracellular route, so which is the major pathway and involves diffusion through lipid layers between cells. Next, transcellular route, where the drug passes directly through the skin cell. Next, appendical route, which occurs through hair follicles and sweat glands and is considered a minor pathway. Understanding these routes help in designing effective topical and transdermal drug delivery systems. So, summary of this Course outcomes describe what students should learn after completing the course and are based on Bloom taxonomy. Semi-solid doses from pharmaceutical preparators that with a consistency between solids and liquids mainly used for external application to skin or mucous membranes. Common types of semi-solid dose form include ointments, creams, gels, or paste. So, dermal penetration drug is the process by which a drug applied on the skin enters and diffuses through the skin layers to produce local or systemic effect. So, the stratum corneum acts as the main barrier of drug penetration. So, the mechanism of dermal penetration involves drug release from the formation and partitioning into the stratum corneum and diffusion across the stratum corneum, that is rate limiting step, and passes through the vagal epidermis and diffusion through the dermis. So, drug penetrates the skin through the three main routes, that is intracellular, transcellular route, and appendical routes. So, on this end of the session, we are going to discuss about the some multiple choice questions and course outcomes describe what student will learn after completing a course. And Bloom taxonomy is used to classify levels of learning. Which is the lowest level in Bloom's taxonomy? Remember, which semi-solid preparation is transparent and non-greasy? That is gel. Semi-solid dosage form are mainly used for external application. Semi-solid dosage form have consistency between solid and liquid. Thermal penetration refer to drug absorption through the skin layers. The principal barrier for dermal penetration is stratum corneum, and partition coefficient represents drug distribution between the skin and formation. And usually question from this session, define semi-solid dosage form and classify semi-solid dosage form and explain the mechanism of dermal penetration of the drug. Thank you.